Hi, how are you? I'm Sherry. I'm going to be a nurse practitioner student. I'll be performing a comprehensive head-to-toe assessment on you today. I'm going to perform some hand hygiene. What is your name?
Richie.
Okay, great. Let me begin. So I'm assessing the skin. The skin is dry and intact. It's warm to the touch. Color is appropriate to ethnicity. I do notice a small mole on the tip of his nose. It is 1 millimeter in diameter. It is not raised. The border is distinct and there is symmetry. Have you noticed any changes with the mole recently?
No.
Okay, awesome. And then we are going to move on to the head. The head is normal cephalic. It is a midline. I am taking a look into the scalp. There is no lesions, no bumps, no masses. The hair is evenly distributed. There is no hair loss. Okay, great. And any changes with the scalp recently?
No.
Awesome. Okay, we're going to move on to the eyes. I'm looking into his conjunctiva. It is pink and moist. There is no capillary hemorrhage noted. His sclera is white on both sides, so that is good. And then I'm going to take out my pen light and I will test for corneal light reflex. Okay, so the pupils on both sides are equal, round, and reactive to light and accommodation. So Perla, that is good. Now we are going to test for convergence. Okay, so close your eyes.
1, 1, 1, 1.
Okay, and then just follow my hand. Okay, great. There is good convergence. Okay, so I'm going to look into the internal ear with the otoscope. I'm going to pull it up and back for an adult. Okay, so the membrane in the external and internal ear is pink and moist. There's a little cerumen noted, but it's not impacted. And then I will now test for the frontal and maxillary sinuses. There is no tenderness. This is the frontal. This is the maxillary. Okay, great. And then I will now look into the oral cavity with my pen light. Say ah.
Ah.
Okay, so the buccal mucosa, there is no growth. The tonsil is intact. The pharynx is pink and moist. There is no problem. The tongue is pink and moist. I'm looking into his gum and teeth. The gum seems a little bit inflamed. Have you been doing oral care every day?
Yes.
Okay, great. Okay, so now I'm going to begin by palpating the lymph nodes. I'm going to start with the preauricular, postauricular, occipital, posterior cervical, tonsillar, submental, and superficial cervical chain. Okay, and last but not least, the supraclavicular, which is right here. Okay, so the lymph nodes that I palpated, there is no enlargement, no swelling, no inflammation, so they're good. All right, so we're gonna move on to the trachea and the thyroid. Okay, so hold your chin up for me. Okay, so the trachea is midline, there is no deviation. So I'm going to palpate the thyroid from behind. I'm going to move the trachea a little bit. Okay, so I do feel the thyroid gland. There is no enlargement, no swelling, no pain. No pain, right?
No.
Okay, so with the thorax, I'm going to assess the patient's chest and the AP diameter. So skin is intact. There's no malformation, no lumps, no masses. AP diameter is 1 to 2. Okay, so now I'm going to see if he's using his accessory muscles. There is no accessory muscles used. There is no respiratory distress. Patient's airway is patent and intact. So I'm going to start by assessing the skin is dry and intact. Okay. All right, the skin is dry and intact on the back side as well. Okay, now I'm going to palpate. No masses, no pain, no nodules. Okay, no pain. Okay, now I want you to say 99.
99. 99. 99.
Vibration is heard throughout all the fields on the thorax, on the posterior thorax, and there is no mass. Now I'm going to percuss on the posterior side. Okay, so there's resonance heard throughout the percussion, except for bony areas, which would be dull. And now I'm going to test for respiratory expansion. I'm going to have my hand on his mid-back, and then I want you to breathe in and out. One more time. Okay, respiratory expansion, it is good. Now I'm going to auscultate his lung fields on the posterior side. Okay, in and out. Okay, now the right side. Okay, so bronchovesicular and vesicular sounds heard throughout all the lung fields. Now I'm going to test for egophony. Say E.
E.
Okay, so E is heard, A is not heard. That means it is good. Patient is negative for egophony. Okay, now I'm going to have the patient lay down and perform the cardiovascular assessment. Okay, so please lay down supine. Okay, so now I'm going to palpate the carotid pulse, so 1 at a time. 2 plus, 2 plus. Now take a deep breath in and hold it. I'm going to hear for bruits. Okay, no bruits heard. Okay, now I'm going to auscultate the cardiovascular fields. Okay, so this is the aortic. I'm over the pulmonic, tricuspid, and mitral. Okay, so heart rate is regular and rhythm is regular. Now I'm going to listen with the bell. Can you turn on your left side? Okay, so with the bell, now I'm going to listen for S3. No gallops or murmurs heard with the bell. Okay, so now you can turn back. All right, so I'm going to palpate the brachial pulse bilaterally, +2, radial pulse bilaterally, +2, popliteal pulse, +2, +2. Okay, bilateral. All right, great. Now I'm going to assess his lower extremities. There is no edema. Color is good. No erythema, no inflammation. Okay, now I'm going to see his toes. There's no cyanosis, no impaired circulation. His feet is warm to the touch. I'm testing for capillary refill on all the toes, and it is less than 3 seconds for the blood to return. Now I'm going to do the abdominal assessment. I will lift this shirt a little bit and perform a hand hygiene one more time. So with the abdomen, I see that it is non-distended, it is not taut, not shiny. Right, and then now I'm going to listen with the diaphragm of my stethoscope in the 4 areas. Hypoactive, 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 hypoactive. Now I will listen to the aortic area. Okay, no bruits. Now this is the iliac artery, no bruits. Femoral artery, no bruits. On the other side, iliac artery, no bruits. Femoral artery, no bruits. Okay, great. Now we are going to percuss for the vertical liver span. Down the midclavicular line. So it is dull on the patient's right side, right below the diaphragm, and it is dull about like 5 to 8 centimeters long, and that is where his longest vertical liver span would be. Now I'm going to palpate the abdomen for any rebound tenderness. Any pain?
No.
Okay. Any bladder fullness? Any urgency to pee?
No.
Okay, great. Now I'm going to test for the rebound tenderness at McBurney's point in the right lower quadrant. Any pain?
No.
Okay, great. Now I'm going to palpate for his kidneys. I will place my hand here. Breathe in and out. Okay, I'm trying to feel it. Any pain?
No.
Okay, great. I do feel a little bit at the edge of the kidney. And now I am going to test for Murphy's sign. Okay, so I'm going to exhale. Okay, any pain?
No.
At the midclavicular line, no pain, meaning that it's good. And now I'm going to test for the obturator sign. So I'm going to lift the patient's leg and hips and flex at 90 degrees, and I am going to rotate it out. Any pain?
No.
Okay, so that is negative, meaning negative for appendicitis. Now I want the patient to sit up again. I'm going to test for the costovertebral angle. Okay, so at the 12th spine, at the patient's posterior back, I am going to place my thumbs at the spine, and then I'm going to kind of measure, put my hand over the left kidney, and I'm going to thump. Any pain?
No.
Right kidney, thump.
No.
Any pain? Okay, great. So patient is negative for pain and negative for CVA tenderness. All right. So now I'm going to begin by testing for the 12 cranial nerves. Cranial nerve number 1, which is the olfactory nerve. So I would like you to occlude one of your nostrils. Alright, I'm holding a strawberry. Do you smell it?
Yeah.
Okay, include the other nostril. Do you smell it?
Yes.
Great, that is intact. Okay, cranial nerve number 2, which is the optic nerve. So with this, we would use the Snellen chart. Have the patient stand back a few feet, cover one eye at a time, and read off the lines of the numbers or letters that are on the chart. And as long as he passes over 3 letters and numbers, then he will get the score next to the chart. So in this scenario, my patient has a 20 out of 20 vision for visual acuity, and he has no need for any corrective lenses. Alright, so we're also going to test for visual field with confrontation. So I want you to shield one eye. Okay, now let me know what number I'm holding up. How many
1,
fingers?
2, 3.
Okay, the other eye.
2, 1, 2, 3.
Okay, great. Alright. And then we are going to use the ophthalmoscope, and in this scenario, I'm just going to describe how to use it. With the ophthalmoscope, we have to make sure that it's in a dim lidded environment. We're going to use it to test for the red reflex, and a normal person would have the red reflex, so they would be positive for it. We will also focus in on the optic nerve, look at the nerve itself, see if there's any deformities or abnormalities, and we will also look into the maculonophobia, and this goes for both sides, both eyes. Alright, so cranial nerve number 3, which is the ocular motor. So we would use the 6 cardinal fields of gaze. So with the H, okay, just follow my finger, okay? Okay, no nystagmus. The eyes move in a really good direction. So with the cranial nerve number 4, which is the trochlear, and the cranial nerve number 6, which is the abducens. So 3, 4, 6 cranial nerves all test for the same thing, which is the extraocular eye movement. And in this case, it is intact. And again, there is no nystagmus noted with the following gaze. All right, next we're going to test for perla, and using my pen light, I'm going to have the patient stare at my nose, and I'm going to take a look into the pupil, see if it constricts. Okay, so pupils are round reactive to light and accommodation, and they're equal. Okay, and then now cranial nerve number 8, which is the acoustic. I'm going to whisper a number into the patient's ear and have the patient repeat it back to me.
17, 18.
Great. Okay, so cranial nerve number 5, which is the trigeminal. At first, I'm going to have the patient clench his teeth, and I'm going to palpate. Okay, great. All right, so now I'm going to test for the sharp and dullness versus dullness with the patient's eyes closed. Now I'm going to use a pen. All right, let me know if this is sharp or dull, okay?
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Okay, great. All right, that is intact. And then now I'm going to, for the purpose of exam, I'm going to explain how to test for the corneal blink reflex. And with that, I'm going to have the patient look away, look towards here. I'm going to use a little cotton swab, and I'm just going to touch it lightly to the cornea and see if the patient blinks. Okay, so that is intact. All right, now cranial nerve number 7, which is the facial nerve. I'm going to have the patient raise his eyebrows, puff your cheeks, give me a big smile, frown, okay, and close your eyes as tight as possible. Okay, and then smile again. Protrude your tongue. Okay, great. That's intact. All right, cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus nerve, will test for voice. So say ah. Ah. Okay, patient has no hoarseness and quality of voice is good. Say ah one more time. I'm going to inspect his pharynx. Okay, so that is intact. Everything is good. So cranial nerve number 11, which is the spinal accessory, I would test for the trapezius, which I'm going to have the patient shrug against my hand. Shrug as hard as possible. One more time. Okay, and then I'm going to have the patient turn his face against my hand to test for the sternocleidomastoid strain. Okay, so muscle strength is 5 out of 5. All right, so cranial nerve number 12 is the hypoglossal. I'm going to have the patient stick his tongue out. Okay, and then move it side to side. Now move it against your cheeks. Great, that is intact.